Vaginal injuries during intercourse, also known as coital lacerations, are more common than you might think. They can be a source of concern and discomfort, but understanding the causes, symptoms, and treatment options can empower you to take control of your intimate health. A coital laceration is essentially a cut or tear in the delicate lining of the vagina. These injuries can occur for a variety of reasons and can range in severity from minor abrasions to deeper tears. It's important to remember that every woman's body is different, and what feels pleasurable for one may not feel the same for another. Open communication with your partner is crucial to ensuring a safe and enjoyable experience for both of you. These injuries shouldn't be a source of shame or embarrassment. Seeking medical attention when needed is crucial for proper diagnosis, treatment, and to prevent potential complications. If you experience any unusual pain or bleeding during or after intercourse, don't hesitate to reach out to your healthcare provider for guidance and support. Remember, your health and well-being are paramount. Recognizing the symptoms of a potential vaginal injury is the first step towards seeking appropriate care. While some discomfort during or after intercourse can be normal, certain signs should never be ignored. One of the most obvious indicators of a vaginal injury is bleeding after intercourse. While light spotting can sometimes occur, especially if you're just starting to be sexually active or if you're experiencing hormonal changes, heavier bleeding or bleeding that persists for an extended period is not normal and warrants medical attention. Another common symptom is pain during or after intercourse. Again, it's important to differentiate between mild discomfort and more severe pain. If the pain is sharp, persistent, or interferes with your daily activities, it's crucial to seek medical advice. In some cases, abdominal pain may also accompany a vaginal injury. This pain can range from a dull ache to more intense cramps. If you experience any unusual pain in your lower abdomen, especially in conjunction with other symptoms like bleeding or pain during intercourse, it's essential to consult a healthcare professional to rule out any potential complications. Remember, early detection and treatment are key to ensuring a swift recovery and preventing any long-term issues. Lubrication plays a vital role in ensuring comfortable and safe intercourse. It helps to reduce friction, which can irritate and even tear the delicate vaginal tissues. When the vagina is adequately lubricated, the friction during penetration is minimized, allowing for a smoother and more pleasurable experience. Insufficient lubrication, on the other hand, can significantly increase the risk of vaginal injuries. Without enough lubrication, the friction between the penis and the vaginal walls intensifies, making the tissues more susceptible to tearing. Several factors can contribute to inadequate lubrication. One common culprit is hormonal changes, particularly those associated with menopause. As estrogen levels decline, the vaginal tissues naturally become thinner and drier, making them more prone to injury. Certain medications, such as antihistamines and some antidepressants, can also interfere with the body's natural lubrication process. Additionally, stress, anxiety, and even rushing into intimacy without allowing enough time for arousal can all contribute to vaginal dryness. A forceful or aggressive penetration is another major contributing factor to vaginal injuries. When penetration is too forceful, it can put excessive pressure on the vaginal walls, increasing the likelihood of tearing. This is especially true if the vagina is not adequately lubricated, as discussed earlier. It's important to remember that sexual intimacy should always be consensual and pleasurable for both partners. Communication is key, and it's crucial to be able to communicate your needs and boundaries to your partner. If you ever feel uncomfortable or pressured during sexual activity, you have the right to stop and discuss it with your partner. Trust your instincts and don't be afraid to speak up if something doesn't feel right. Remember, intimacy should never come at the cost of your physical or emotional well-being. Section 5. Anatomical variations and their significance. Just like every other part of our bodies, vaginas come in all shapes and sizes. What is considered normal can vary widely, and it's essential to remember that there's no one-size-fits-all approach to intimacy. Anatomical variations, such as a naturally thinner vaginal lining or a more shallow vaginal canal, can sometimes make individuals more susceptible to injuries during intercourse. However, it's important to emphasize that these variations are perfectly natural and do not mean that pleasurable and safe intercourse is impossible. Understanding your own body and being aware of any potential sensitivities is crucial. Open communication with your partner is also paramount. By sharing any concerns or preferences, you can work together to find positions and techniques that feel comfortable and enjoyable for both of you. Remember, there's no shame in seeking guidance from a healthcare professional if you have any concerns about anatomical variations or if you're experiencing discomfort during intercourse. They can provide personalized advice and support to help you navigate these issues and maintain a healthy and fulfilling sex life. Section 6. When to seek medical attention. While minor vaginal discomfort after intercourse can often be managed with self-care measures like rest and over-the-counter pain relievers, there are certain situations where seeking immediate medical attention is crucial. If you experience any of the following symptoms, it's essential to contact your healthcare provider or visit an urgent care facility as soon as possible. Heavy or prolonged bleeding. Bleeding that is heavier than a normal period or bleeding that lasts for more than a few hours after intercourse should always be evaluated by a medical professional. Severe pain. Pain that is sharp, intense, or interferes with your daily activities is not normal and requires medical attention. Visible laceration. If you can see a tear in your vaginal tissue, it's important to seek medical care, as you may require stitches or other treatment to promote proper healing. Signs of infection. Fever, chills, foul-smelling discharge, redness, swelling, or pain that worsens over time can all indicate an infection, which requires prompt medical treatment. Remember, early diagnosis and treatment are essential for preventing complications and ensuring a swift recovery. Don't hesitate to seek medical help if you're concerned about your health. Your well-being is paramount. Section 7. Treatment options and self-care. The treatment for vaginal injuries sustained during intercourse depends on the severity of the tear. In many cases, minor tears heal independently with proper hygiene and rest. Gently cleanse the area with warm water and mild soap after intercourse, and avoid using harsh soaps, douches, or scented products, as these can irritate the delicate tissues and delay healing. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help to alleviate any discomfort. Applying a cold compress to the area for 15 to 20 minutes at a time can also help to reduce swelling and pain. For more significant tears, your healthcare provider may recommend stitches to close the wound and promote proper healing. In some cases, topical medications or estrogen creams may be prescribed to help with healing and reduce dryness. Severe lacerations, while rare, may require surgical intervention to repair the damage. Section 8. Prevention and maintaining vaginal health. Preventing vaginal injuries during intercourse involves a combination of open communication, mindful practices, and prioritizing vaginal health. Openly communicating with your partner about your needs, desires, and any discomfort is crucial for a safe and enjoyable experience for both of you. Ensuring adequate lubrication is paramount in minimizing friction and reducing the risk of tears. If you experience vaginal dryness, using a water-based lubricant can significantly enhance comfort during intercourse. Avoid using oil-based lubricants with condoms, as they can degrade the latex and increase the risk of breakage. Practicing gentle and consensual intercourse is essential. It's important to remember that intimacy should never be painful, and if you experience any discomfort, communicate it to your partner and adjust your approach accordingly. Maintaining good vaginal health also contributes to preventing injuries. This includes practicing good hygiene by washing the area with mild soap and water daily, wearing breathable cotton underwear, and avoiding douching, as it can disrupt the natural balance of bacteria in the vagina. Regular checkups with your gynecologist are essential for monitoring your vaginal health and addressing any concerns promptly. Section 9. Importance of open communication. Open and honest communication with your partner is paramount when it comes to intimacy and sexual health. It's crucial to create a safe space where both partners feel comfortable expressing their needs, desires, and boundaries. Before engaging in sexual activity, talk about what feels good and what doesn't. Discuss any concerns you might have, including any history of vaginal discomfort or pain during intercourse. If something doesn't feel right during intimacy, don't hesitate to speak up. It's perfectly okay to pause, adjust positions, or stop altogether if you experience any pain or discomfort. Remember, intimacy should be a shared experience that brings pleasure and connection, not pain or discomfort. By communicating openly and honestly with each other, you can cultivate a fulfilling and enjoyable sex life while prioritizing the health and well-being of both partners.